Hello and welcome to those entering the virtual room this afternoon. We are welcoming people to our general practice data sharing with Northwest Melbourne PHN information session, which is focusing on our change from PenCS to Outcome Health as our software vendor. So we're just waiting for people as they enter the virtual room. While you're coming into the room, you might want to consider updating your participant name to reflect your name in case it has an email address or a different name or practice name. So just we know who is in the virtual room with us today. And we'll just give people a moment to join before we officially kick off. Okay, we might just give it a couple of about 30 seconds until we officially kick off while I can see people still joining us. It's lovely to see so many people taking time out of their busy day to join the session. Okay. As it's a couple of minutes past 12, what we might do is officially kick off and welcome you all to our information session on our transition from PenCS to Outcome Health. My name is Jessica Holman and I am the Director of the Primary Healthcare Improvement Team here at Northwest Melbourne PHN, and I'll be your guide and facilitator today through our information session. Firstly, I do want to start by acknowledging the traditional owners of the land on which our work takes place, the Wurundjeri people, the Bunurong people and the Wathaurong people, and pay my respects to elders past, present and emerging, and pay my deep respects to any Aboriginal and Torres Strait Islander people in the meeting with us today. Just a couple of very brief housekeeping reminders. What we're going to do today is actually keep everyone on mute. So just a reminder to Microsoft to put yourself on mute for the very beginning of the session while we're running through the formal part of the information today. You are very welcome to ask questions throughout the session, though, via our chat box, which will either be answered by our team members and people in the meeting today, or will be also answered in our Q&A session, which is happening later in the session today. Just a note as well to say this session is recorded, which is really helpful because as post this session, you'll be able to share this session with people who weren't able to make it today or anyone in your general practice team who wants to be aware of the information presented in this session today. So firstly, I'd like to provide a bit of a purpose and an overview of our session today, and also take the time to thank each and every person who has joined us from their general practice and taken the time away from the busy and important work of working with your patients and the business of general practice. So thank you for joining us. Today we'll be running through some information which is helpful for your general practice teams on the change that we are making from PenCS to Polar. So part of that, we'll be walking through the background and context to the change. We'll be explaining what's changing and why, and what this means for your general practice teams. We'll be talking through some of the key dates and milestones for the transition activities, and we'll also hear from the Polar team from Outcome Health who are here to meet with you and to answer any of your questions, who will provide a little bit of an overview about the Polar tools and applications that will be available. But just to note, today isn't a deep dive training session on Polar. That will come later in the year, and we'll talk a little bit about the milestones for the training and education on that. So if you are here to hear a little bit more and a deep dive into the tools, please wait for those other education sessions. But for now, is your opportunity to hear from the team at Northwest Melbourne and Outcome Health on the transition to Polar. So the team that's in the virtual room supporting the information and content that you'll hear from today, we have two organisations who will be working through this information with you for your general practices. So firstly, from the Northwest Melbourne Primary Health Network, we've got Emma McEwen, who's the Executive Director of Insights, Performance and Digital Services. We've got myself, and we've got Philip and Jocelyn, who have been working closely to support the activities of the change, as well as work to support your general practices around this change. We've also got the team from Outcome Health here, and they are the ones who will be answering specific questions you might have about Polar platform, and you'll have Diego, who's really active in answering some of your questions through the chat. We've got Peter, who's going to provide us a bit of an overview, and we've got Jamie here as well, who's going to answer some questions. So firstly, I just wanted to start by giving a little bit of a reminder about the background and context to data sharing and data sharing tools and analysis tools that your general practice has access to in the Northwest Melbourne region PHN. So as you know, general practices collect and store data in their clinical information systems. If they wish, general practices can share de-identified versions of this data with their local primary health network. The collection of this data is governed by a data sharing agreement signed by practices between the practice and the PHN. So there are three main outcomes and reasons for general practices sharing data with their PHN. One is the PIP-QI incentive program, where eligible practices can receive their PIP-QI payment by submitting the PIP-eligible data set to the local PHN. The other is for quality improvement support. So PHNs can provide tailored quality improvement support to all of the general practices in their region based on the needs of their practice and its patients' population. Practices can also perform self-directed improvements using the clinical audit tool. Population health planning. PHNs use the de-identified data in population health planning that is submitted by the general practices to help with their health and needs assessments, which are submitted to the Australian government and that are used for designing and informing the local response to service delivery and commissioning around the identified needs of the region. So I'm going to hand over now to Emma, who's going to talk a little bit about the process that the Northwest Melbourne team undertook and the reason for the change and some of the background information. So thanks, Emma.
Thanks, Jess. Hi, everyone. Thanks for joining today. So Jess spoke to a couple of uses of the data extraction and analysis tools that general practice are provided with, and some of the uses for the data that PHNs have that you share with us. Over the past year, we have carried out a review of the different options available in the market, because essentially we want to make sure that we're efficiently delivering on the Commonwealth's request of PHNs to sample data and provide practices with a tool that's really practical and useful for their quality improvement needs. The timing of this has been driven by a couple of different factors. So it's driven by some of the policy and primary care reform directions. Also, and potentially most predominantly, our contract with our current vendor, NWMPHN, was due for renewal in June this year. So we really took that as an opportunity just to take stock, have a look at what it is that the PHN needs, and most importantly, general practice needs, and really try and understand what's available in the market to ensure we're sort of getting the right product to meet our needs. I think it's also important here just to mention that in addition to the contract being up for renewal, the PNCS products are changing, and so the current tool that general practices had access to, CAT4, being one of the main PNCS tools, that was actually being decommissioned. So regardless of which vendor we actually landed with after the assessment, there was going to be some change required, even if we were to have stuck with PenCS. Being very conscious of the impact that this change has for general practice, as well as our internal teams at the PHN, we really wanted to make sure that we undertook a rigorous and evidence-based review of the available options to ensure the tools were of most relevance and providing the most benefit for all users from various perspectives. So just in terms of a relatively high-level overview, if we can just pop to the next slide, I just wanted to walk you through just a couple of really the main steps in the evaluation that we undertook. So there's three main tools on the market. So that's the PACCAT tool set from PenCS, Polar from Outcome Health, and Primary Sense, which is developed and managed by the WA Primary Health Alliance. So the evaluation activities took about 8 months and included the following key steps. So we developed a detailed list of both functional and technical requirements. That was both from the perspective of the different use cases for general practice and also the use cases for us as a PHN. So we actually developed and sort of wrote up those use cases or scenarios, and then we used those as the basis to actually test each of the three tools. So we tested each of the tools, starting with the existing product and tool set that we had from PenCS as a baseline, and then we recorded the outcomes of those tests and the assessment in an evaluation matrix. During that process, we also received product demonstrations from the vendors and sought some response and input from them about their future development roadmap and new functions and features that the tools would have in the near future. As a result of that, we shortlisted, if you just go back one, we shortlisted the PenCS and Outcome Health tools. And then at that point, we engaged with each of those vendors to have more detailed discussions around costing, what are the data hosting, what's the data hosting setup, what are the technical requirements, and also what are the steps that we would have to undertake to transition from our current tool to the new tools, and what would also be required of general practice. In addition to the vendor notification and having those details discussions, a final presentation was requested from the vendor to address more questions in more detail about that future product roadmap and how they engage with PHNs in general practice as well. Throughout this process, I think it's really important to note that we also engage with PHNs that are currently using each of the tools or have recently transitioned to one of the tools as their new offering. This was really important so that we could understand their experience of not only using the products on a day-to-day basis, but also the experience of general practice and the experience of going through that transition process as well. So as a result of all that, the Outcome Health tool was selected based on the results from the evaluation, pricing, and also the performance of Outcome Health as a vendor during the process. Throughout that process, the Outcome Health team displayed a really strong commitment to maintaining open, transparent conversations with us and to really working with us in general practice to ensure that the tool is tailored and meets our needs and general practice needs in the future as well. What does that basically mean for all of you as the day-to-day users of the tool? So commencing from April 2025, you will all have access to the Polar tool as a part of the free tool that we offer as a PHN. We have started the process of sending out new data sharing agreements to general practices, and hopefully you've received that. If you haven't, please let us know, because what you need to do is sign that agreement, provide us with some additional information, and then the installation process can be started. We're aiming to have everyone onboarded to the new tool with Polar by the 1st of July 2025. So of course, we really want to make sure that we're providing really tailored support to people that are to practices that are high users and frequent users of the tools, to make sure that we're minimising disruptions as much as possible. Jess will talk about that specific support in a bit more detail shortly. Of course, it's important to note that from the 1st of July, we will cease funding the PenCS tools. There are options if a general practice does want to continue using those tools, in addition to using the Polar toolset to hopefully share that extracted data with us. You can still speak to Penn about that if that's something that you'd really like to do. Another very important thing to note is that we will be using PenCS to submit the PIP-QI data for this quarter. So that's the data that you share with us over the April and June period. To ensure that there's no disruption to the incentive payments related to that, we are asking that you submit data from April or May. But your contact at the PHN may reach out just to have a chat to you about that and make sure that we've got the data that's needed to ensure those payments come through for you. So that's it from me. I think Jess is going to go through that in a bit more detail, so I'll hand back to her.
Thanks, Emma. What I wanted to just talk through, obviously, Emma's given a little bit of a high-level overview of those milestones, but what we've got here is a bit of a roadmap to the journey that we're going to be doing with you and your general practice teams around support and the support of the change management within your general practice. So I just want to say at Northwest Melbourne PHN, we want to be really responsive to your individual general practice needs. So at any time, if you need support or us to be doing other things to help support this change, please let us know. We want to hear from you. We want to hear about the strategies and activities that will help support this change in your general practice, because we're really conscious of making a change that's going to help drive and continue the drive of the quality improvement activities and work that you use these tools for. So we want to minimise disruption, and we want to ensure there's a really smooth, supportive process. So just to touch on some of those activities that we'll be working with you and your general practice team is, obviously we have communicated the change across our communications platform and now having this information session. Your general practice team should have also received your new data sharing agreements. So if you haven't received those data sharing agreements, please reach out to the team. Also happy for you to directly message the education in the chat if you want to communicate that directly with us now. But those have all been sent, and we are starting to receive those back and co-signing those to enable you to start getting access to the Polar tools. During April and May, we are going to be focusing on ensuring that we've got 100% compliance rate for all of our general practices who are submitting data through PEN for our PIP-QI quarter. During April and May, we are developing and looking for people to contribute to the co-design of the general practice education training program that will support the use and uptake of the Polar tools to really help general practices understand how these tools can be applied in their general practice to help improve patient and business outcomes. During May and June, we'll really be focusing on the support for general practice to transition to the Polar tools through the installation, onboarding and change management. On the 30th of June will actually be the last day that general practices will have funded access through the PHN to the PenCS tool. And from 1st of July, all general practices in Northwest Melbourne will have access to and supply the Polar tools. Commencing from July, we'll have an activity and strategy for our general practices teams to engage in the education training activities to help onboard and support the use of the Polar tools in your general practice. Just a note to say, we've got a range of practices going through this process with the PHN, and really this is going to be based on your needs in your general practice. So the transition activities around training and education, application and use can go as quickly or as slowly as you need them to be. So as a PHN team, we'll be reaching out to each of our general practices who share data, including those frequent and high users of the PenCS tool, to really work to understand your needs in your general practice around the transition and how we can be supporting that. So although we'll be running things out across the region, we will also be working really closely with your general practice team to support that change based on your needs and requirements. So practically, what are the steps the practices need to take as of today? So as I mentioned, your practice will need to sign a new data sharing agreement. Once the agreement is signed and co-signed by the PHN, we will create a practice profile for you in Polar and we'll contact you to arrange a time for a remote installation. Once you've booked an installation time, Outcome Health will be in contact to confirm the installation time and instructions on what to prepare for the installation. Polar is only installed onto one server or computer within the general practice or cloud environment. And the feedback we've received from general practices to date who have had the installation complete was that it was quick and painless. So that's testimony from some of our practices who have gone through that process. And if you've got any specific questions about that, please pop them into the chat, as the Outcome Health team are very happy to answer those. Just a reminder, as well, as we're talking about data sharing agreements and access to the Polar licenses, for the PIP-QI, to meet the PIP-QI requirements, there's two options for sharing data with the PHN. So we just want to be really clear about those options, as it is absolutely in the hands of the general practice to choose how they share data with the PHN. So option one is by submitting their full de-identified data set using Polar. That's where you will receive a Polar license. You'll submit de-identified data, which will be extracted automatically and on an agreed schedule. And practices can share their entire de-identified data set with Northwest Melbourne PHN, at the same time letting their patients know they're doing that as part of consent. Option two is that general practices can also submit an aggregated PIP eligible data set through a JSON file method, which is a manual method via a Polar portal. So this is a manual extraction where there's a file that's extracted out of your clinical software and that has the aggregated PIP QI eligible data set that make up the 10 measures. And this can be submitted to the PHN via the Polar portal. So there are two options for sharing data. And if you or your general practice team want to know more either about data sharing or about the change or work through this as a team, the PHN is really happy to support you by virtual or in-practice visits, over the phone, or answer any questions via email. We are absolutely here to support your general practice navigate this. So I've mentioned a couple of elements of this, but I just wanted to go a little bit deeper into what support your general practice should expect from the PHN. What we're really wanting to do during this period is ensure that we really have a good understanding about the requirements of your general practice during this change with the data sharing tool. So what we'll be doing is providing tailored support from your dedicated relationship manager to talk through with your general practice team your needs, your requirements, any questions you have, and support. What we'll also be doing is we're starting to reach out to our priorities. We'll have priority support and strategies for our frequent and high users of the PenCS tools. So we know who those general practices are, as we've got the data from PenCS that indicate who is using CAT4 and TopBar, for example, beyond just data sharing with the general practice teams. So we'll be reaching out to those general practice teams to ensure that we've got minimal disruption between your use of using the PenCS tools to the Polar teams and help create a plan of support around that. We'll be rolling out, as I mentioned, education training for individuals and practice teams on using and making the most out of Polar tools in your general practice. Your general practice team will also have access through a website hub and the Polar platform, resources, articles, quality improvement recipes, case studies, hearing from how other general practices use Polar, and reports to help you get the most out of the Polar tools in your practice. We'll also have included in that hub a range of frequently asked questions, which will be updating regularly based on the real life questions that are coming from our general practice teams as we support them with either data sharing agreements, the use of Polar, the transition activities, or PIPQI. We also have a dedicated inbox and a transition team in place to help support the change across the PHN as well as the general practice, and also a dedicated helpline to help assist with questions or inquiring regarding the transition to Polar. So before I move on to outcome health, as we've gone through some of the PHN supports, I just want to reinforce as well to all of the general practice teams that we really acknowledge the change that this means for you and your teams, and we want to be there to support you. So please, if you have any suggestions or questions or feedback on how the PHN is doing that or how we can be better supporting your general practice during this period, please let us know. I am going to hand over now to the team from Outcome Health so they can talk you through their tools and their approach. So thank you, Peter.
Thank you. Hello, everyone. My name is Peter Latinovic. I'm the IT security specialist for Outcome Health. I'm also accompanied by Jamie Supple, who's our BI director, and also Diego Benitez, who's our service desk manager and education lead. So thank you very much for taking the time to kind of get an understanding of who we are as well. I think it's important. So Outcome Health is more than just a Polar tool. We try and create innovation for informed decision making and health connectivity. I know that's a lot of words, but I know it will make more sense as we go through this presentation. We are a not-for-profit organization, so that means that we reinvest into the people, we reinvest into the tool sets that we have to make sure that we create better outcomes for the communities. We operate in 3 different areas. By the way, Outcome Health has been around for about 20 to 25 years, so we're not new in Australia. But there are 3 core areas of the business is the mental health and chronic disease support services. We do a lot of mental health nursing placements, and we also work closely with Ambulance Victoria on a number of projects. Too far? Yeah. The second part of our business is the Polar tool, which stands for Population Level Analytics and Reporting. I forgot that on Thursday last week, but I made sure I remember it this time. We do data extraction, and obviously we have the analytics platform. We also deployed in over 2,000 GP clinics across Victoria, New South Wales, Queensland, ACT, and Tasmania. And the third part is the Aurora research and ethics-based ecosystem to conduct research. All of the research studies are on opt-in basis and obviously de-identified basis. We also have a lot of governments and strict rules of who are the parties that we work with for various research. And obviously everybody's informed well ahead of time.
Okay, all right. Just thought I'd better ring you back just in case. That's all. I'm sorry.
Okay. So the Polar platform. Polar leads to efficiencies with a minimal human intervention. So what does that mean? We have a very small Hummingbird client that gets installed into a practice, and that's it. We manage everything else from the tool perspective. We do automatic software updates. We also do automated data mapping. So really the footprint inside the practice is minimal, and as a web-based system, we can then manage everything from the back end. We are a secure platform. While we only take the identified data sets, our approach is to pretend that it is identifiable information. So a lot of the security controls and governance we put across the tool are very much are very strict, and we're trying to make sure that we protect the data that we have. We are a centralized web-based ecosystem, and the three primary tools that come with Polar is obviously the Polar dashboard itself. We have the Walrus, which is the point of care tool. I believe that's the top by equivalent that Penn CS has. And a Husky, which is an addition, which is an appointment book optimization with broader checks. Cool. So as we talk about some of the automation pieces, I think it's important to talk about data mapping briefly. We effectively take the complexity of all the unstructured data that lives within the practice, within their practice management system. And then we do a couple of things. We either take the SNOMED diagnoses and we map them to SNOMED codes. Then we can use those SNOMED codes to do higher order groups. Or we can take immunization pathology and we create higher level groups. It just means that if you're focusing on a particular area, I don't know, chronic disease like respiratory, you'll be able to include all the various pieces of relevance within that. And obviously, you start digesting some of the reports that we have within the Polar, particularly a clinical summary report, you'll see where all those advantages come into play. Next, so obviously all web-based reporting. The reports come in two styles. There's the data discovery, how many patients do I have, and where you can effectively identify the patients within the practice for whatever, if you're focusing on a particular cohort of patients, whether it's particular MBS items or various risks, you can go how many patients do I have within this cohort, or we can do guided analytics, which are purpose-built reports just to meet that particular function, including hospitalization, risks, quality improvements, PIP-QIs, and chronic disease reporting, including diabetes, CKD, cancer screening, etc. The next, I want to talk about quickly about Walrus. So that is the point of care tool. It is a local installation. When you log into the dashboard, if you've got the downloads, you can download it yourself and install it. It's been made to run without administrative requirements. So it runs within the user profile, so it should be easy, but keeping note that it's only compatible with best practice and medical director at the moment. So the Walrus tightly integrates with the clinical system. So as you're working on patients, you'll have that particular patient information pop up. However, it is the same Polar delivery, same Polar content that we have extracted and transformed. So you get that power of the data within that Walrus point of care tool. Yep, I think that kind of it's a good introduction to what Outcome Health is. If you have any questions, please feel free to reach out. Otherwise, we'll see you along the journey.
Thanks so much, Peter. And while I've got you, there was a question that came up last week. So in our previous information session, so I just thought I'd ask it because we do get it come up quite frequently. How often does the Polar data refresh itself in its reports?
Yes, I do remember the question. So we the Hummingbird will refresh that, I believe, every 5 minutes. So when the Hummingbird tool is installed, it will do a full data extract. And then it's clever enough to do only partial extractions as the data changes. All the data that gets landed, we tend to churn through the data every 24 hours, and all the reports should be refreshed every 24 hours.
Great, thank you. Another question that we've had, sorry, well, I'm going to put you on the spot for a couple, is also what's the impact of that on the speed of the general practices software running or their computer system?
Yep. So again, very, very good question. Again, because we only take partial changes as data changes, the actual effect on the system is much, much lower. So obviously when Hummingbird is installed, there'll be a slightly higher utilization while we kind of catch up. Once we're caught up on the data sets, they're very tiny little extracts from then on.
And Saeed has a question, a clarification point. He says, or he or they, sorry, at a server level, full data update, I think that's there.
Ed, I want to try and interpret a question. Please tell me if I misunderstood. Hummingbird integrates directly with the PMS or practice management system. So they actually, best practice, for example, has a third-party integrator list, and we are on that list. So we will effectively extract the full data sets. Well, not everything, sorry. All the things we require for polar data extraction and reporting. And then we will track those tables for changes, and then we will take them. Now, Hummingbird is generally installed on a server where best practice MDO PMS is installed. However, obviously, if you prefer to have it at a different location, you just have to let us know during the installation process. I hope that has answered your question.
We'll keep an eye on the chat, and what we'll do as well, I'm going to just go through a couple of the other FAQs, but during that time, if people have got follow-up questions, they can either put them into the chat, or also we're going to we're going to move away from the formal presentation, open up the floor for question and answer, where you can jump off mute and ask questions to anyone from the PHN or from Outcome Health. So if you want to start preparing your questions, then we can go through those. So we'll just go back to the previous slide, as there was a couple of quick questions I wanted to run through that come up quite frequently. And there is a question about this session being the same as last week's session. They are the similar content that we're running through, but obviously, depending on the questions we get, they might be slightly different. So to those wondering, yes, it is a repeat of the content, but also an opportunity for people to ask different questions if they've had others that have come up. So thanks for that question there, Gina. So historical data access, how would it work with the data that was extracted by PenCat previously? So historical data from a practice's PMS system will be available in Polar and can be used to generate reports in Polar. So as we've talked about as well, practices won't have access to those PNCS reporting functions unless self-funded from the 30th of June. What will happen to our general practices access to the PenCat tools? So as we've talked about, they'll no longer be able to access or log into PenCat tools, and we'll be able to self-fund. And what happens to the data that we've already have with PNCS? So data extracted from the PNCS tools that Northwest Melbourne PHN has will be archived and not used for the PIPQI program moving forward from 30th of June 2025. Okay, we've got some, meanwhile, it's really great. We've got some questions in the chat. So Sonia, thank you for your question about Hummingbird and Walrus, and are they like Top Bar? So Peter, I'm
here.
Might get you to talk through that. And to say as well, before you jump in, Peter, this is a question we get really frequently about what each of the, what's Walrus, what's Hummingbird. So what we're going to do is add those definitions to our FAQs as well for everyone. So thank you for that question. Over to you, Peter, and we can probably stop sharing now, Laura.
Thank you. Thank you for the question. So again, so Hummingbird is the software that's really just responsible for the data extraction piece. So that integrates, that's usually installed on the server, and will talk to your practice management system. So that takes all the data out, and then we can use the data to curate the reports. Walrus, I guess you can consider it as it actually consumes the data that we've presented. So Walrus gets installed on your machine that you're currently logged in and working on, and you have the practice management system open. That's where Walrus will be installed and used. And then all the various notifications that have been pre-programmed Walrus will start popping up as you change patients within your practice management system. So I guess Hummingbird extracts, and Walrus is just another way of accessing the data that we have prepared.
Great.
One thing I will add on Hummingbird is that Hummingbird is the thing that manages the advanced security. So while Hummingbird will extract the information from the clinical information system, anything identifiable doesn't leave the clinical environment. So when we extract information, it's based on an identifier basis rather than an identifiable name or email address or anything that can link back to that sort of patient directly. So when we re-identify the reports in the clinic, so when you look at a report and you see the patient names in the report, it's Hummingbird that's doing that advanced restitching of the patient names into the reports, because we don't actually extract them from the clinic. So, anyway.
Thank you, Peter and Jamie. Sonia, I hope that has answered your question. And Saeed's got a related question about the training, and absolutely the feedback has been really clear about general practices wanting a bit of a deep dive into these tools, so Walrus, Polar and the like. So we'll be working closely with the outcome health team to do a bit of a deep dive into that. But also some really in-depth training that's based on your general practice needs, as well as some case uses on how to use those tools to do certain functions within your general practice. So please be reassured that this isn't the end of hearing from us and these information sessions. And like I said, we'll be doing some more hands-on training sessions also. There was a question here for the outcome health team on are the extracts based on a practice's entire patient base or only their current patient base?
Diego, I think you answered the question. If you like, you can answer it.
Yeah, I did answer it. So after the initial data extract, we only extract data changes. We won't do another full extract. So it's quite small in comparison. And we don't extract patient data that have opted out from data sharing. So we honor that in the clinical information system.
I'll just add another potential interpretation of that question, which is that if you've got patients marked as inactive in the clinical information system, we do extract them, assuming that they haven't opted out, because that's one of the filters that you can actually use the filters in the reports to look at your inactive patients as well. So they are extracted, not just the active patients.
Hey, thank you. I'm just checking. I think we've covered all of the questions in the chat, but please want to open up the floor for anyone to, you can pop your hand up or you can just come off mute, and might just hold the space for any other questions.
Can I ask, while we'll be doing the transition, so currently we use top bar almost daily, so there'll be time we are transitioning. So I'm assuming we'll keep using top bar until we have got a tool Polar's providing us, which will be replacing. There won't be any gap between those two.
So that time frame, we can work with you to make sure that you've got a really good transition period. So at the moment, we're really, once we have a data sharing agreement between you and the PHN, we're really happy to support that installation to happen as quickly as your general practice needs that to, so that we've got a good time between you having your ceasing using the top bar tool to moving to the Walrus tool, but also understanding the different functionalities and how that applies in your general practice setting, because we really are aiming for minimizing the disruption but great to hear that you've had such good use of top bar, and sounds like a general practice that we can also showcase, and that this is the work we want to be doing more, showcasing how our general practices are using these tools and getting the most out of them as well. So we might be in touch about that as well. Thanks for your question. I can see Gina's got her hand up. Hey, Gina.
Hello.
We can hear you. Perfect.
Just a quick question in regard to the milestones and key dates that you've got there. Is it possible for us to get an email or something with just those on it so we can keep track?
Yeah, absolutely, Gina. What we're going to do, we're going to create a bit of a resource for our general practices. So if that's helpful for you, we'll make sure we send that out with our frequently asked questions as a bit of a one-stop shop for general practice, because we really want you to be able to share and communicate this with your broader team as well. So if that's helpful, then...
And in regard to the training, to actually show, you know, the replacement for top bar and all that, are you going to put that on calendar, or are you just going to send through emails?
We'll put that in our education training calendar. We'll make sure that goes out through via eBlast. So just a reminder as well for people to make sure that they're following us. They've signed up to our newsletters, but we'll make sure the relationship managers are going to be following up individually with all of our general practices to help support them through this transition during this time as well. So you'll hear from us then at that point, but you'll absolutely hear from us about those training and education sessions, which we know are really pivotal.
Okay, thank you.
My pleasure. So we might just pause for a moment, see if there's any more last questions. But while we are waiting for any last minute questions, just a reminder, we have got a slide that's got, question from Karen, sorry. Outcome health team might throw to you who have many general practices using the tool and users. Can you give some indication of how user-friendly the tools are? Or the user experience, if you like.
Well, it's a bit hard to answer. I mean, it's good. It's really open for interpretation of what easy and hard is. So there's a bit of a learning curve. I'm not going to lie. But at the end of the day, it all comes down to how much you want to get out of your tool, and the tool. And we always say, we have some really heavy users across board that absolutely love the tool. Once you get over the learning curve, I haven't seen PenCat, but I know it's very different. You know, it's basically changing from using email on Outlook to using email on Gmail. It's same but different. But once we do notice those gaps, we identify the gaps of where people struggle to use the tool. So with the things that we'll be covering on the training sessions. So there is a bit of a learning curve just with like any software, and it's reporting software, so it can be quite complex. But having said that, some of our reports are very intuitive, so they're very easy to use. The training on those will be quite straightforward. It's mainly the clinic summary report where we throw all your data at you. You know, they're the ones that probably have the biggest learning curve, but Wara is very easy to use, same with some of the other reports.
Just a comment on that. We also spend a lot of time listening. So if there's anything you're having trouble with, please let us know. Diego uses a fantastic tool called Storylane, which allows him to put together walkthroughs, what you may previously know as recipes, really quickly and easily in a very visual, easy to consume way. So if there are things that you'd like to know ahead of time, then we can potentially prepare some of those for you. And if there are things that people are having trouble with, or there are common questions that aren't covered by the existing education, then we can put together education around that as well. Because the last thing that I want is people having a tool that they are not comfortable using, because we want to make sure that you get the most out of it. So there's a question just come up about looking backwards. So this is one of those ones that that we don't just extract your current data. We go back in time and extract the data from some of the things are limited. So we only go back 7 years for things like MBS services claimed and pathology and those types of things, but things that are relevant to the entire patient life, i.e. diagnosis and immunisation, those things are extracted regardless of time period. So you do have that ability to go and have a look at historical data. With specific looking at the PDSA, we can't make available any of your pen existing reports and numbers, but you will have access to historical data within POLA. I'm hoping that. Yes, you can. to the question, but that's also available in your PIPQI reporting, which is historically based. So when we calculate PIPQI, we calculate PIPQI nightly for you. So therefore, if you're running a quality improvement, or you've got been doing some administration on your cohorts, then you can see those changes the next day in your PIPQI. We also recalculate PIPQI back in time for the previous 12 months. So therefore, you can see that full trending. And obviously, smoking is one of those items in PIPQI.
Great. Thank you so much, Jamie. And just a note, for general practices who receive our PIPQI reports, they will continue as well. But you will also have as Jamie mentioned, a whole suite of new type of reports to explore in POLA. And I just wanted to add as well, so obviously we'll be doing some education training sessions with POLA around usability and functionality to support your general practice teams, but we will also have our QI program officers who will be able to provide in-practice support and training around the tools to help you make the most of those tools in your general practice as we're moving through this change as well. So I wanted to just mention that because I think it's really important that you can have two sort of streams of support for your practice team during this time. I do want to just check there's no more last questions, but I do want to say thank you to each and every person who has taken the time to hear about our transition and change to the outcome health team, and thank them for participating and answering some of the questions. Thank the team at Northwest Melbourne, but like I said, thank you all for coming along, taking the time out of your day. We are absolutely here to support. We want to hear from you. We would love any feedback as we go along about the tools, and also we'll be calling out for people to have suggestions on the type of training, education, information they need to support them during this change. So please scan the QR code. We will be sending out post this session to everyone who's registered and to those who attended the slides, as well as there'll be some further information coming out around the frequently asked questions, some of the information we shared around the milestones and activities, as well as the support that you'll receive for general practice. Thank you so much for joining us today, and I hope you have a great day and rest of the week.